Good afternoon, and thank you for joining us here in the Washington, D.C. office of Mathematica Policy Research, and also to everyone attending via webinar. My name is Tom Fraker, and I am a senior fellow here at Mathematica. It's my pleasure to welcome you to our Disability Policy Forum on improving employment outcomes for youth with disabilities. The Center for Studying Disability Policy was established in 2007 to help build the evidence base for sound, effective disability policy. Findings from CSDP research can help inform disability policies and programs across the nation to better meet the needs of all Americans with disabilities. One way that we do this is through our disability policy forums. In December 2013, 1.2 million individuals ages 13 through 25 with disabilities received SSI payments with a total annualized value of $8.7 billion. Today's speakers will present research findings on interventions that have improved employment outcomes for some of these teens and young adults. The findings offer hope that well-designed policies could help youth with disabilities make positive contributions to the U.S. economy as adults and avoid the poverty trap of long-term dependency on SSI. Today, we'll hear from a distinguished panel of speakers. First, Arif Mamoon will describe the youth transition demonstration and tell us about the impacts the YTD projects had on youth with disabilities 3 years after they enrolled in a rigorous evaluation of the demonstration projects. Dr. Mamoon is an Associate Director of Human Services Research here at Mathematica. He specializes in the design and implementation of experimental and non-experimental evaluations. His work covers a broad range of policy areas, from disability to international development. Next, Kelly Crane will describe the implementation of the YTD project in Miami-Dade County, Florida. Among all of the YTD projects, the one in Miami generated the most positive results. Dr. Crane is a senior research associate at Transcend Incorporated, which provided technical assistance to the YTD projects. She provided the TA to the Miami project. Her areas of expertise include research, outreach to youth and employers, and the alignment of systems to improve programs and services for youth with disabilities. Finally, Laurie Timmons will present findings on the causal relationship between the early work experiences of youth with disabilities and their later employment success. Dr. Timmons is a research economist at Mathematica with substantial experience using large, complex data sets to conduct quantitative analysis of factors affecting employment and how financial incentives influence medical expenditures in the delivery of health care. We are honored to have Jamie Kendall with us today to discuss these findings and put them in the context of federal policies and initiatives for transition-age youth with disabilities. Ms. Kendall is employed by the Administration for Community Living at the U.S. Department of Health and Human Services, where she serves as the Director of the Office of Policy Analysis and Development and as the Acting Director of Independent Living. During her career, Ms. Kendall has worked to develop policies and provide leadership to programs that aim to help low-income families and people with disabilities. For example, she was the initial federal project officer for the YTD evaluation while she was employed at SSA. Before we get started with the presentations, I have a few housekeeping reminders for the audience. Our session today includes both an in-person and an online audience that is joining us via live webcast. To help ensure the highest possible sound quality, for our webinar participants. We ask that those of you with us here in DC silence all of your electronic devices. Please note that we are video recording today's session and may capture images of you in the audience. This recording will be posted on our website next week. At the conclusion of our presentations, we welcome questions from both our in-house and our webinar audiences. For those of you participating via webinar, please submit your questions electronically through the Q&A panel on your screen at any time during today's forum. And we will alternate your questions with those from our in-house audience. Now, I'm pleased to turn the podium over to Arif Mahmood.
Thank you, Tom. Good afternoon, everyone. I am Arif Mahmood, and as Tom mentioned, I'll be talking about the 3-year impacts of the Social Security Administration's Youth Transition Demonstration Projects. At the outset, I would like to recognize the evaluation team, including staff from Mathematica and MDRC, and also the technical assistance team from Transcend. All of their efforts culminated in the findings that I'm presenting today. I'd also like to acknowledge the input and guidance we received from SSA staff. Transition to adulthood is challenging for all youth, but for transition-age youth with disabilities, they face additional challenges regarding their health, social interaction, and support needs. And these challenges complicate their planning for future education and work, often leading to poor employment outcomes and a lifetime of poverty. So at this critical juncture of the lives of these youth, it's important to provide support, and recognizing that SSA undertook the YTD initiative. The target population for the YTD initiative included youth ages 14 to 25 who were either receiving supplementary security income payments or were at risk of becoming recipients. The goals of the initiative included improving employment and other outcomes for youth with disabilities and reducing their dependency on SSI in the long term. YTD projects delivered services between 2006 and 2012, and the final evaluation report presenting 3-year impacts is now available to the public. I'll mention a link to the report towards the end of my presentation. Because SSA was interested in testing interventions that are grounded in best practices, the YTD program model was based on guideposts for success developed by the National Collaborative on Workforce and Disability for Youth. The key components of the YTD intervention included individualized work experiences, SSA waivers and benefit counseling, family involvement and support, youth empowerment, and system linkages. I would underscore the core component of the YTD intervention in terms of employment-focused services. I'll come back to it in a few minutes as I provide more details on the intervention services. For the evaluation, we had 6 YTD projects in the national evaluations. They're listed on this slide. The first 3 of these projects, that is Bronx, Colorado, and Erie projects, they delivered services between 2006 and 2010. And the last 3, that is Miami, Montgomery County, and West Virginia, provided services between 2008 and 2012. For youth who participated in these projects, they received services for about 18 months. Let me provide you a little bit of context about the youth who enrolled in the evaluation by describing some key baseline characteristics of these youth. In 5 of the 6 sites, we had the project serving youth who were disability beneficiaries and were primarily on SSI. The exception was the Montgomery County site, where about 1 in 5 of the enrollees were SSA beneficiaries. Most enrollees in the 5 sites had mental illness, intellectual or developmental disabilities, or learning disabilities, or ADD. About 15 to 20% had physical disabilities, and another 5 to 10% had sensory impairments. At the Montgomery County site, the youth enrolled were students with severe emotional disturbances. The youth school enrollment status also varied by site. In the Bronx site, for example, only 6% were not enrolled in school, whereas in Colorado, Erie, and West Virginia, over half were not enrolled in school. Across 5 sites, a large fraction of the youth enrolled, between 42 to 68% of the youth, had never worked for pay at baseline. The Montgomery County site was again an exception, where about a quarter had never worked for pay. Despite the significant challenges and disabilities faced by these youth enrolled in the evaluation, in each site, over 2/3 of the youth expected to leave independently in 5 years. For the national evaluation, we used an individual level random assignment design, and we recruited over 800 youth per site into the evaluation, and then randomly assigned them either to a treatment group where they received YTD services or to a control group where they received, where they did not receive YTD services but could access existing services in their communities. Each YTD project enrolled about 400 treatment group youth in project services. As I mentioned earlier, employment-focused services was a core component of the YTD interventions. And the key employment services included support for resume preparation and job searches, job development, that is outreach to employers, job placement, post-placement support, and benefit counseling. And technical assistance was particularly important for job development and job placement. The table on this slide summarizes findings from the evaluation's process analysis that used data from the project's management information systems. And I'd highlight 2 points that come out of the numbers in the table. The first one is that in 4 sites, in Bronx, Colorado, Erie, and Montgomery County site, about half of the total hours of services were for employment-related services. For Miami and West Virginia, it was even higher. About 2/3 of the total hours of services were employment-related. The second point I would mention here is the intensity of service, or hours of service, employment service actually, varied by site, ranging from 27 hours in West Virginia to 22 hours in Miami and 21 hours in Bronx. On the other end, Colorado and Erie projects delivered about 4 to 6 hours, 4 and 6 hours of employment-related services to youth participating in the projects. So we looked at 1-year impacts of the YTD services on youth outcomes. And what we found is that all projects increased youth receipt of employment services. And 3 of these projects also had statistically significant positive impacts on having a paid job in the first year. So overall, these 1-year impacts sort of held promise for the 3-year impact, 3-year impacts that I'm going to present in a few minutes. Okay? So for the 3-year impact analysis, we focused on outcomes in 5 domains: paid employment and earnings, youth income, participation in productive activities, contact with the justice system, and self-determination. In each domain, we had 1 or 2 primary outcomes and several supplementary outcomes. Principal findings for the evaluation were based on estimated impacts on the primary outcomes. For the evaluation, we used data from 2 surveys conducted for the evaluation, the baseline survey and a 36-month follow-up survey. We also relied on administrative data from SSA, benefits records, and IRS earnings records for earnings and employment. Okay? So with that, let's turn to the results for the 3-year impact analysis. So as I said, I'll present findings and estimated impacts for the primary outcomes in each of the 5 domains I mentioned. I'll start with the employment and earnings domain, and the outcome we're seeing on this slide is whether youth had ever been employed in a paid job in the past year. And the blue bars show the estimated control group mean for each of the sites indicated on the horizontal axis. And the estimated impacts are shown in red for each of the sites here for the same outcome. So you can get a sense of the relative size of the impacts relative to the control group mean. So more specifically, we found that both at the Erie and Miami YTD projects, youth in the treatment group were 8 percentage points more likely to be employed during the past year. And so these impacts were about 20% larger relative to the control group mean for the Erie site, and about 30% larger relative to the control group mean in the Miami site. For the West Virginia project, when we looked at the data from the survey, we estimated an impact of 6 percentage points, but it was not marginally not statistically significant with the p-value of 0.11. But when we look at the employment measures based on IRS records, we found an estimated impact of about 8 percentage points, and that was statistically significant. So overall, we conclude that the project had positive impacts of 20 to 25% relative to the control group. Moving on to the next slide, which shows the annual earnings in the past year and the estimated impacts on that outcome for each of the sites. And we found that the Miami project had positive and statistically significant impact of about $615, which is a 50% increase relative to the control group mean. And we also found positive impact of over $1,100 at the Montgomery County site, which is about a 20% increase relative to the control group mean. Next, we turn to the primary outcome in the domain of youth income. And the outcome we're looking at here is the youth total income from earnings measured through the survey and SSA benefits measured from SSA administrative records. And we found that 5 of the 6 sites had positive and statistically significant impact on youth total income. In 4 of these sites, the positive difference in earnings actually contributed to the positive impact we saw in total income. In 4 other sites, we also see that increased benefit amounts actually contributed to the increase in total income. And this was not surprising that we found positive increases in benefit received, and that was because there were specific waivers allowed to participants with the YTD projects, which allowed the youth to retain more of their earnings, more of their benefits relative to their control group counterparts. More specifically, I'd mention 2 of the waivers. One is the earned income exclusion waiver, which allowed YTD participants which reduced YTD participants' benefits by $1 for every $4 of earnings, compared to a reduction in benefits of $1 for every $2 of benefit in earnings for control group. And the Section 301 waiver, which delayed the effectuation of a negative medical determination or age 18 redetermination, which allowed, again, the treatment group youth to retain more of their benefits. So for these waivers, it was not surprising to see positive impact on benefit receipt. The next outcome is for the domain of participation in any productive activities. The primary outcome here captures engagement in employment or education or training, and we found positive impacts in 2 of the projects, in Miami and West Virginia, about 8 percentage points. And the relative sizes of these impacts range between 13 to about 13 to 20 percentage percent relative to the control group. The next domain is contact with the justice system, and the primary outcome here is whether the youth were arrested or charged with delinquency or criminal complaint during the past year, preceding the 36-month follow-up survey. And for 2 projects, we found negative and desirable impacts, and those are Bronx and Miami sites. These are sizable impacts relative to the control group. You can see for the Bronx site, the reduction is about 50% compared to the control group mean. And for the Miami site, so for the Bronx site, it's actually a 50% reduction. And for the Miami site, it's about an 80% reduction compared to the control group mean. On the Colorado site, we do find a positive and non-desirable or undesirable impact. of a sizable magnitude. The positive impact there is about twice the size of the control group mean. Now, none of these projects focused on delivering services that would reduce contact with the justice system. So we're not sure what's causing these impacts. But I'd like to note one point, that the projects where we see desirable impacts provided intensive employment-focused services, both at Bronx and Miami, whereas the Colorado side, they didn't have that level of intensity for employment-focused services. Okay? And the final domain I would highlight here is youth self-determination. And the measure here is an index of self-determination that we constructed using data from the follow-up survey. And we did not find any significant impact on this outcome. Okay? So before I wrap up, I'd just like to highlight impacts across all of these domains for one particular site. I picked Miami because, as Tom mentioned earlier, we see consistent evidence of positive and desirable impacts across multiple domains. As you can see, the Miami project had positive impacts on paid jobs, on annual earnings, on total income, productive activities, and contact with the justice system. Okay? So to conclude, given the evidence and the estimates we found, both looking at the primary outcomes and across all of the supplementary outcomes we analyzed, it seems that giving substantial doses of well-designed and well-implemented services to youth with disabilities can improve key transition outcomes in the medium term. And the other point I would like to highlight here is technical assistance facilitated the delivery of the employment-focused services and helped the projects to maintain focus on employment, particularly for the phase 2 projects, that is Miami, Montgomery County, and West Virginia projects. Technical assistance was critical part of the project implementation, and Kelly would tell us more about that in her presentation. The third point I'd like to highlight here is when we looked at impacts at 1, 2, and 3 years, impacts on employment and earnings, we found a mix of evidence in terms of the impacts of the projects. When we look at the impact on employment and earnings based on IRS records, we found that the impacts are declining over time. However, when we looked at the survey data, we see appearance of positive impacts on employment and earnings for Bronx and Miami sites, where we did not see positive impacts at 1 year. I'm sorry, at Erie and Montgomery County site, where we didn't see positive impacts at 1 year mark. So we have this mixed bag of evidence, and it's hard to draw solid conclusions from this evidence in terms of how sustainable these impacts would be. We also found no evidence of reduction in the amount of disability benefits, but as I mentioned, this is not surprising given the SSA waivers for YTD participants. And finally, the transition services that were provided to YTD participants can affect contact with the justice system. In situations where we saw desirable impacts, it can have significant influence on policy implications, particularly because contact with the justice system has large costs for local governments and the society at large. Okay? And here are the links to the 2 documents that are related to the 3-year impact analysis. The first one is the YTD Final Evaluation Report. For a 9-year study, it's a pretty streamlined report of 150 pages. The second item is an issue brief, a much shorter document of 7 pages, so hopefully more easily consumable. Okay? That's all I had to say. Thank you. I'll hand it over to Kelly Crane now.
Thank you, Arif. Good afternoon, everyone. I'm happy to be here today to talk about YTD. Again, I'm Kelly Crane. I'm with Transcend, and I coordinated the technical assistance across all the YTD sites, and as Tom mentioned, I served as the lead for the Miami-Dade site. So today I'm going to talk to you specifically about the intervention in Miami and share with you the training and support we provided to them so that they could deliver their intervention and meet the outcomes of YTD. So the Miami site, it was fondly known as Broadened Horizons, Brighter Futures, or BHBF. And they served the entire Miami-Dade County area. Because it was so large, they divided the area up into two service delivery areas, the north and the south. And they had staff dedicated to both of those areas. So the intent of YTD was to test those promising approaches to make youth become more self-sufficient and less dependent on disability benefits. All the sites were to offer employment services, benefits counseling, and linkages to other community supports. In Miami, they followed this intent, and as such, their objectives focused on enhanced pre-employment services. And by that, what they did is they worked with these young people to identify their strengths, their interests, their skills, and make that match to employment. Meaningful work experiences were also offered to the YTD participants. So for years, we've been examining the employability of persons with disabilities. And we know that work experiences, especially paid work, is the strongest predictor of post-school employment success. We know this to be true regardless of the disability category, where somebody lives, or their economic status. So this was the case in Miami. All youth were offered, YTD youth were offered meaningful work experiences. And these transition services were combined with benefits counseling. So the Miami YTD project was awarded to ServiceSource. Their leadership staff consisted of a project director and an MIS administrator. Both of these individuals only worked part-time on the Miami project, and they were based in Clearwater, Florida, which was about 2 hours from Miami. On site, there was a project manager, one project manager, and she supervised all the staff. There were 5 customized employment specialists. And the role of the employment specialist was to work directly with those YTD youth, again, to make that match and move them toward employment. The job developer, on the other hand, focused more on that employer customer. So that person reached out and did a negotiation with employers. The project started out with one job developer, but when they recognized the importance and the need for this position, they ended up having 3. And then, of course, there were 2 benefits specialists who worked with the YTD participants. As I mentioned earlier, there were 2 offices in the north and the south, and they had staff in both of these areas. So Arif talked to you about the guideposts to success. The YTD model did draw on these guideposts for success, which are developed by the National Collaborative on Workforce and Disabilities for Youth. Miami also drew on these components, but they customized them to better meet their unique needs. So their components, intervention components, included individualized work experiences. This is really central to their YTD project. They offered youth opportunities for company tours, job shadowing, volunteer work, and of course paid employment was central. Person-centered planning or self-determination. Again, staff would really work with these youth to identify their strengths, their skills, their interests, and then develop an individual job plan for them and move them toward that employment piece. Family engagement. Families were offered training, opportunities for networking, and there was also a lot of information sharing. Informally, Miami engaged families through the planning process. The staff often met with families in their homes. So this was really a natural and an easy way for families to be engaged in that planning process with the youth. There were more formal opportunities to engage families as well. Miami had several training opportunities in which they invited families, and these training workshops were on topics related to transition, special education, their rights and responsibilities. Of course, the site also had strong connections with other community services. The staff, as I mentioned, worked hard on identifying those needs of the individuals, and then they would make connections with other community service providers. Some examples of those were around healthcare, transportation was a big service that they connected with, and childcare. School-based activities is another intervention component. In Miami, they had an extremely strong relationship with the transition coordinator at the Miami-Dade County School District. And so they coordinated with this individual to identify those career development and technical skills training activities for their youth. Benefits management allowed families to better understand the waivers. Reese mentioned a couple of those waivers, and other SSA program rules. The benefits management came in the form of benefits counseling and financial education. And then finally, they offered follow-along services. So this is an important one. Once youth were placed in a work experience or paid employment, the staff would follow along and provide support to that youth, but also to that employer. So what was Transcend's role? As I mentioned, we provided technical assistance to all of the YTD projects. I was the point for the Miami-Dade site, and as such, I assisted them in defining what their intervention was, and then I provided technical assistance and support to the site so they could deliver that intervention with fidelity. All the technical assistance that was provided to the Miami-Dade site was coordinated and informed by the evaluation. So that continuum of technical assistance was an integral part of the YTD model. The technical assistance really sought to build the capacity in the sites so they could deliver that intervention. We delivered technical assistance in a variety of ways, and it was intense, and it happened over the course of the YTD project. So I'm going to take a moment and talk about a couple of these. Early on in the project, I provided a number of training opportunities and workshops for the Miami-Dade staff. I actually went on site, and I tried to build knowledge and skills and share tools and strategies to implement best practices around job development and job placement. As the site evolved, we moved to more one-on-one technical assistance to individual staff. I actually went out into the community with staff to meet with families and with employers. The site also had opportunities to interact with some of the other YTD sites. We did this very formally through monthly webinars. These webinars offered an opportunity for all the sites to dialogue. Typically, we would pick a topic for the month, and the sites would come and share their strategies and lessons learned around that particular topic. I also participated in weekly staff meetings, and during these staff meetings, staff would come with their challenging cases, and as a team, we could explore various solutions around those challenges. And then I was available to staff via email and phone anytime, and they knew that, and they took advantage of it. But this allowed us to address their needs immediately. So by working closely with the site and monitoring their progress over the first year, it became clear that we needed to have a stronger emphasis on those employment services. So let me put this in context for you. In Miami, the majority of the staff came from a human services background. Typically, people in this field go into this field because they want to help others. They have a strong desire to help others. So what we found in Miami was the staff was really great at engaging and working with the youth and families, but they weren't as comfortable reaching out and working with that employer customer to negotiate positions. So as a result, staff ended up managing youth from crisis to crisis as opposed to moving them toward employment. So to address this concern, the technical assistants and the evaluation team came together, and we reinforced that message of employment and that need to focus on employment services. We started by having that real honest conversation with the site. We basically told them that their employment outcomes weren't acceptable and something needed to change. And one of those things that changed was the technical assistance. It became more prominent and field-based. It was at this time that I started to go out in the field more with staff to meet with those youth and actually do that discovery, develop that individual plan. I also went out with staff to negotiate positions with employers. This really gave me an opportunity to model best practices, but also observe what they were doing. And as a result, they were better able to hone their technique. In addition to providing field-based support to the line staff, Miami also set a numeric goal around employment outcomes. The site chose to develop both a site goal and individual staff goals. And they based these goals by looking at their labor market information and also caseload size. Once those benchmarks were established, on a monthly basis, we'd look at data reports with the team. And these reports provided a snapshot on how staff was doing against those employment targets. It also looked at individual efforts. So as the TA liaison, I could look at those reports in the context of employment and see how much activity was happening around job seeker related activities versus employer outreach activities. And it was, as a result, better able to target the technical assistance that I was providing to the staff. These data reports also allowed a context for the site to reorganize staff. They started this by identifying the strengths of each individual staff members, and then they signed cases based on those strengths so they could draw upon those strengths. We also spent a lot of time really defining the roles and responsibilities of the various staff members. For example, what the a customized employment specialist does versus the job developer. So this process of repeatedly reviewing these data reports allowed the site to keep their momentum and their focus on paid employment. By establishing these clear expectations and spending the time to define roles and responsibilities was also helpful for the project manager. She was able to take this information and better determine who was a good match for this position and who wasn't, and it helped with some of the hiring. So what did we learn? We learned that you need to have a well-defined intervention. Miami spent a lot of time identifying and defining the services that they would be delivering to the YTD participants. They also spent a lot of time identifying the key stakeholders. And once those were identified, what are the various roles and responsibilities? And as I mentioned earlier, we repeatedly talked about roles and responsibilities and who did what and who provided what services. I was then able to coach them through this process so they could consistently and effectively deliver the intervention. And it's important that there was consistent delivery of services. I also want to point out that Miami was very receptive to the technical assistance provided to them. We also learned that the components of the guidepost is a good framework for delivering transition services. And Arif talked about those components earlier. So we need to use those components such as work experiences, family engagement, benefit services, system linkages. We need to look at those components to guide our practices when we're moving youth from transition to work. And then finally, in Miami, both the intervention and the technical assistance really focused on work experiences and paid work. And we know this to be the strongest predictor of post-school employment success. So YTD was a really good test of looking at work as not only a key intervention, but the outcome. It's a subtle distinction, but an important one. If we want youth to work, work needs to be part of that intervention, and we need to partner with staff to give them the skills, the strategies, and the knowledge to teach youth how to move toward paid employment. Thank you.
All right, thank you everyone for coming today. I'm happy to be here. My name is Laurie Timmons. I'm a researcher with Mathematica. I should mention that the work I'm going to present to you today is joint work with Tom Fraker, also from Mathematica, Arif Mamoon, who presented first today, as well as Eric Carter, who's from Vanderbilt. So Arif's presentation on YTD showed that youth with disabilities who were provided a mix of services, one of which included early employment experience. These youth had labor market success 3 years later, post-baseline. What's unclear, however, is the extent to which different factors, different components of this mix of services, which ones mattered more, as it was all as a bundle. Today, what I'm going to do is I'm going to talk to you about the role that early labor market experience alone plays in affecting subsequent labor market success amongst youth with disabilities. So there's been a lot of important research that's been done on this in the past. And most of this research finds that early labor market experience is a very important predictor of later labor market success. Now that said, a lot of this literature focuses on patterns of correlation. There could be some unobserved factors, such as motivation of an individual, the type of disability, that could affect the decision of a youth to have early labor market success as well as later labor market success. So it's really important to take these factors into account. What we're doing today is I'm going to show you new estimates of this relationship between early labor market experience and subsequent work experience. However, rather than looking at the association in this relationship, the goal here is to really derive causal estimates of the impact of early labor market experience on subsequent work status. So here, when I'm talking about a causal relationship, here the cause is early labor market experience, and the effect is later work experience. So we're really focusing on the extent to which early labor market experiences determines later employment. And I'll go into more detail shortly, but we do this by using a unique, rich longitudinal data set that follows youth with disabilities over time. So determining what factors influence adult employment experience for youth with disabilities is an important policy consideration. So for all youth, as Arif mentioned, the transition to meaningful employment can be quite challenging. However, in particular, youth with disabilities face unique challenges in gaining meaningful employment related to their health, social isolation, access to supports and services. In turn, it's been long recognized that due to such challenges, many youth with disabilities have difficulty attaining meaningful employment. I have a statistic on there that from Newman and co-authors, and it's estimated that less than 40% of youth with disabilities were working after leaving high school. So that's a pretty low number. As such, it's of important policy interest to determine exactly what factors can influence adult employment amongst youth with disabilities. As I discussed, there's been quite a bit of important research in this area that has looked at the role of early labor market experience on subsequent employment. I have some citations there. And as I also said, this research generally finds that early work experience is a strong predictor of future employment outcomes. Indeed, many recent policy initiatives, such as the YTD intervention, as well as the Department of Education's promise, focus on providing early experience to improve adult employment outcomes. So this study, as I said, in this study we're providing new estimates with the goal of determining the causal effect of early work experience on later employment. Now, as I said, it's important that we want to take into account any unobserved factors that can be influencing the decision of an individual to have early and later work experience. For example, it could be that those with early labor market experience are those who are very motivated, who are very ambitious, those whose disability makes it easier for them to work. And these are the same individuals who are likely to have later employment success. So we want to do our best to take this into account to derive causal estimates. Okay. Now, the data that we use to do this is a unique, rich longitudinal data set. Here in our study, we're using data that comes from the YTD intervention, which Arif had discussed in detail earlier. Now, youth are surveyed at baseline 1 year later and 3 years later. So we see the same individuals 3 times over a relatively short period. There's detailed information on the youth, demographic information, health, parental background, such as education, household income, expectations about employment, and these are collected at each survey. Now, our measure of employment is, they ask at each survey, were you ever employed in a paid job within the past year? So this is going to be in this study, when I'm talking about employment experience, this is the question that they ask youth in the survey. In our sample, we focus on youth who are aged 16 to 20 years of age at baseline, and we focus on those who are receiving SSI benefits. So we're really focusing on youth who are at or near high school completion age in our study. And I should mention that this is not an evaluation of the YTD intervention, which is what Arif had discussed previously. Rather, we are using the YTD data to really get at this question of determining the causal relationship between early labor market experience and later. And I should also mention that in the study, we're including all youth, those who received services and those who did not, so in the treatment and the control group. Okay, so here, as I said, the main relationship of interest is to what extent does earlier employment, and here we measure that by 1 year after baseline. How does that affect later employment success? And by later, that's 3 years post-baseline, because individuals are surveyed at baseline, 1 year post-baseline, and 3 years. Now, I'm not going to go into the nitty-gritty here for the geeks in the audience like me who like equations. I will indulge you a bit. So here, just so you can see the clicker, the key dependent variable that we're interested in is employment for individual I 3 years post-baseline. And the factors that affect that, one of which could be employment experience, 1 year post-baseline, EI1. There could be observed factors such as family background, the type of disability of the individual, years of education, and then there could be unobserved factors that I denote by VI3. Now, the main relationship of interest that we're interested in is this coefficient on EI1, which is theta. So when I show you results of estimates, it's going to be on theta there. Okay, I'm done. So if you don't like math, you can tune back in now. Now, I'm not going to go into the nitty-gritties of the empirical approach I take, although if you're curious, I'm happy to answer questions on them. But just to provide a bit of intuition here, what we do is we exploit the longitudinal nature of the data, of the YTD data set here. We use fixed effects estimation, and what the fixed effect estimation does is it allows us to control for unobserved characteristics of individuals that are fixed over time, such as I said, motivation, ambition, for example, that could be correlated with an individual's self-selection into early employment and later employment. and then as well as observed factors, and I give some of their family background, race, the YTD site. I also have state controls and state unemployment rate that we're including as predictors. So it may seem a bit like magic that we're controlling for these unobserved characteristics, but just a general intuition here is the fact that we see individuals 3 times, and that allows us to capture these fixed characteristics, unobserved characteristics. Okay, so now I'm going to present some descriptive statistics here of what we see in the data. We see that overall, 36% of youth have paid work experience at 3 years post-baseline. Perhaps unsurprisingly, the number is slightly larger for those who are older, 18 to 20 years of age, 37%. However, we see quite a bit of disparity between those who have early work experience at 1 year post-baseline and those who do not in terms of their employment outcomes 2 years later at 3 years post-baseline. So here we see that if an individual worked, 60% of those individuals who worked in 1 year post-baseline, 60% of them also worked 2 years later. However, those who don't work 1 year post-baseline, only 26% of them work 2 years later. Okay, so we see this positive relationship between early work experience and later work experience. The numbers are pretty similar for the older age group as well. Okay. And I should mention that they're not controlling for any factors. That was just the raw data. Now in this slide, here we're controlling for different factors that could also be influencing employment outcomes 3 years post-baseline. So the first estimates, these are the estimates of theta, which I showed you in that equation before. These are estimates of theta. Here we find that first, this naive regression, this is a regression where we're not taking into account those unobserved characteristics of individuals. We are taking into account the observables, which I had mentioned, but not the unobservables. So this is what is similar to what's been done in previous literature, and I'm applying it to our data. So we're calling this a naive estimation. Here we find that individuals who are, or looking at the first one, the 16 to 20-year-olds, we find that if you're employed 1 year post-baseline, that increases the probability by 27 percentage points of you being employed 2 years later for youth with disabilities. Okay, we see it's slightly higher for the older age group in this naive estimation, where employment 1 year post-baseline is associated with an increase of employment 2 years later by 36 percentage points. Now, in the fixed effects estimation, the second row there, here we're taking into account those unobserved characteristics that are fixed over time, such as motivation, ambition. And here we see that the size of effects are considerably smaller than in the naive estimation, which perhaps isn't surprising because, as I said, we're taking into account these unobserved factors that could be influencing both early and later employment. That said, however, the size of the estimates are still pretty sizable. Overall, we find that employment 1 year post-baseline increases the probability of being employed 2 years later, 3 years post-baseline, by 13 percentage points overall. We still find it's positive for the younger age group when we split it by age, although it's not statistically significant, so we can't say too much about that. We do find that the effects are concentrated amongst the older age group, 18 to 20-year-olds. In particular, employment experience 1 year post-baseline increases the probability of being employed by 17 percentage points 2 years later. Now, this 17 percentage points is pretty big when you compare it to the fact that in the 18 to 20, about 30% of them, 37% of youth with disabilities are employed. So that effect, even though it's smaller than the naive estimation, is still pretty sizable. Next, we look at if there's any variation across YTD sites. There could be differences in the types of individuals in different localities, different labor market conditions. And just quickly, we find that there is variation across different sites in this relationship. However, for all of them, except for one, it's statistically significant. There's one where it isn't. So we find that this relationship still holds, although the extent to which this relationship holds varies across site. Okay, so to summarize my results, the findings of our studies show that early work experience, it substantially increases employment among youth with disabilities receiving SSI. For youth 18 to 20, the older age group in particular, paid employment 1 year after baseline increases the probability of paid employment at 3 years, 2 years later, by 17 percentage points. As I said, the size of the effect varies across YTD sites, but is consistently positive and is statistically significant for 5 of the 6 sites. Our findings provide causal evidence that early work experience, it is indeed a key determinant of later labor market success for youth with disabilities. The effect is sizable, although it is smaller than the naive estimates, but in terms of policy implication, these causal estimates are more reliable, arguably, than previous work. The findings suggest that early work experience could shape the trajectory of employment amongst youth with disabilities in adulthood, as well as possibly beyond. And the findings support recent policy initiatives that are targeted at transition age youth with disabilities. So the challenge really is to provide these youth with disabilities with early employment experience to improve their later labor market success. If you have any questions, I have contact information of all of the co-authors there. All right.
Thank you, Laurie, and thanks to all our speakers. As a reminder to our webinar audience, we'd love to hear from you. Please submit your questions now via the Q&A panel on your screen. After our discussant's remarks, we'll direct your questions to our speakers. I'd now like to welcome Jamie Kendall to give us her thoughts about the findings we've just heard and how they might inform federal policies regarding youth with disabilities. Jamie?
Thank you, Tom. And a big shout out to all of my former SSA colleagues, Jeff Hemmeter, who I see in the back of the room. I know Joanne Cobb is on the line, and others who worked on this research project, both pre-award in the design and post-award in the implementation. So I'm just so pleased to be here today with my colleagues from Mathematica and Transcend to be a discussant for this very critical research that was conducted under the YTD project. So as Tom mentioned, I did serve as the first project officer for this project, and I remember thinking when working on the drafting of the statement of work, data won't be here till 2014, and that's going to be forever. And here we are today. So this is personally and professionally very rewarding for me to be with you all today. So now I work at the U.S. Department of Health and Human Services. I'm no longer at the Social Security Administration, but I'm continuing to work on policy issues in my capacity as the Director of the Office of Policy Analysis and Development at the Administration for Community Living, and now also as the Acting Director for Independent Living Administration. So today I want to emphasize 3 points around this research. First of all, this data shows really a lot of promise to assist policymakers in designing and implementing strategies for promoting competitive integrated employment for youth with disabilities. And this is very relevant findings for not only my agency, but for several agencies across government that are working on promoting successful outcomes for youth with disabilities. Secondly, data is very important right now to the federal government. We are really pushed to show evidence in order to be accountable. We're in tight budget times, and we need to be able to show that how we're spending federal funding is relevant and evidence-based. So this data is very exciting in that regard. My third comment I'd like to make is that systems change takes time and effort, and a lot of what you heard, especially my colleague Kelly talk about in her remarks with TA, is very relevant to that. We need to continue this work to move systems along in positive ways, and I'll be talking a little bit more about that. So at any rate, the Administration for Community Living really works to try to balance a vision so that individuals with disabilities do not choose between healthcare supports to work and live successfully in the community. We really believe that all individuals with disabilities need to have access to competitive integrated employment as options and as a pathway to achieving that goal. So as a person with a disability myself, I know how important these values are, and the guideposts that Kelly spoke of around self-determination, independence, inclusion, and full community participation should be including all people with disabilities. I know sometimes families are often not exposed to these foundational values early, and I think that was some of the guidepost work with family support as well. And we are moving towards having higher expectations for youth with disabilities, which is very exciting. And again, YTD showed and demonstrated that that was an important part of the program. So I want to point out that although this was a Social Security funded study, the findings have really broad implications across government. There is a GAO report recently that found that there are more than 45 federal programs supporting employment for people with disabilities. So for the most part, these programs are at Department of Education, at HHS where I work, Department of Labor, and we try to work across those systems together in order to support our transitioning youth. And so that's where the systems change effort does come in at both the federal and state level. And we know we need to improve this for overall well-being for people with disabilities. Employment is an important pathway out of poverty. In 2012, the poverty rate for individuals with disabilities between the age of 18 and 64 living in the community was 29%. The poverty rate for individuals living without disabilities, 16 to 64, living in the community, 13%. That's a poverty gap of 15.7 points. We want to move that in a more positive direction, and I think employment is key. So in terms of these findings in promoting federal government moving forward, there are some initiatives now where this data will continue to serve to drive our efforts. One thing I want to highlight is the federal partners in transition. I see some folks in my audience who've been working on that, Shay being one of them. And this is really a work group where we are trying at the federal level to promote systems change and looking across Social Security, Department of Education, Department of Labor, and HHS to see how we're transitioning youth and how we can look at compatible outcome goals. So we did just finish a strategic plan, and we came up with a set of outcome goals that we are looking at, and that includes that youth with disabilities and all youth have an equal opportunity to access integrated work-based experiences in high school and to better understand how to manage and enhance their skills to promote career planning and to make a successful transition from school to work and independence. We would also like to develop self-determination and engage in self-directed individualized planning for post-secondary education, healthcare management, vocational training, and employment. We want to make sure we're connecting our transitioning youth to programs, services, and activities that are eligible for all youth to be able to manage their plans for moving forward. This includes pursuing meaningful careers, becoming financially literate, making informed decisions about their lives, and developing leadership and advocacy skills to make decision-making around being a leader and have involvement from their families to promote high expectations. So YTD is very relevant to the work that is going on at the federal level with that policy. I would also like to speak about a very important piece of legislation that passed in July of last year, the Workforce Innovation Opportunity Act. And this piece of legislation modernized the workforce system for the United States and really had some important pieces for transitioning youth, and I will point out a couple of those. The first is an advisory committee that was established to help the federal government understand how to promote competitive integrated employment for people with disabilities. And so this committee is charged with preparing and submitting a final report to Congress and the Secretary of Labor for recommendations to increase employment opportunities for youth with intellectual, developmental disabilities or other significant disabilities to promote competitive integrated employment. This committee is meeting now. I know the Youth Transition Subcommittee actually had a meeting yesterday, and these findings are very relevant to the work of that committee. The second important part of this legislation is an increased role in transition for state vocational rehab services. So each state's public VR system now will have a much larger role in transitioning youth from school to adult life. And so under this new legislation, 15% of each state's VR funds must now be for transitioning youth services, and specifically pre-employment transitioning services, which we found through YTD was an important component. And so very relevant. Finally, and very important, is that we have a new requirement which provides for a formal cooperative agreement between the state VR agency and the state Medicaid and DD agency. And this will really push states to work comprehensively to collaborate, and means that VR will have in place agreements, in particular for individuals with intellectual and developmental disabilities and significant disabilities, and others who will need long-term care funded by Medicaid. So, my final example of where these data that all my colleagues presented is relevant is an example from my own agency. At the Administration for Community Living, we have some projects funded through our Administration for Intellectual and Developmental Disabilities, which promote system change. These are projects for integrated employment, and the work here around system change is aligned well with the goals of the YTD program. So the goals of these state partnerships, of which we required collaborations at the state level between the Department of Education, the state DD agency, the VR agency, and our DD councils, which really move forward and develop policies that support competitive integrated employment, remove barriers to competitive integrated employment, enhance state-wide collaborations, and implement strategies for young adults and transitioning youth. There's been some successes of these projects. Several states have achieved passage of Employment First legislation, which we're very excited about. One state has determined no more subminimum wage for transitioning age youth. States are looking at updating their rate restructures within their state contracts to promote integrated competitive employment, and also really looking at strengthening their data collection to inform data-driven system change efforts. So I think the examples also provided through YTD only buttress and dovetail with the work of our PI projects. I also want to note that it's not just the federal government, but it's the state government that's innovating and pushing. And last year, the National Governors Association focused on employment for people with disabilities through the Governor's Initiative. And recommendations included a number of noteworthy things that are relevant today. First, that employing people with disabilities should be part of the overall workforce agenda, not separate. So we want to keep integrating people with disabilities into the systems we have in order to achieve success. Secondly, employers are critical, and Kelly touched upon that in her remarks with getting the systems changed with the staff to focus more on the employer piece. We need to be preparing young people to be part of the workforce. That does include an expectation, and we talked about that a lot today as well. And we need to be continuing to leverage resources. So as we move forward with these systems change efforts, the YTD data will continue to be useful at the federal level and at the state level. In closing, I just want to say a couple of things. First, it's really exciting to see that showing well-designed services to youth with disabilities improves key transition outcomes, and including but not limiting to earnings, and it's very, very exciting. We learned through these demonstrations that technical assistance makes for stronger interventions. And as we move forward in the federal government, I think it's important for us to take note of that. We also know that we need to continue to follow these youth with administrative data, and I'm sure Social Security is doing that to see if impacts on paid employment and earnings are sustainable over the long haul. In terms of the guideposts, it's really fantastic to see further reinforcing data that work experiences, youth empowerment, engaging families, system linkages, and benefits management are all important and effective for youth transition framework. And seeing that the role of work as an intervention as well as an expected outcome, and that's very key, is really fantastic. And this is something that our systems change work needs to really keep focusing on. So finally, Laurie's work with the fixed effects model, when she controlled for unforeseen factors like motivation, like type of disability, really showed a causal relationship. And that evidence that early work promotes later work is really, really important. So I hope that we continue to move this barometer in a positive direction. And with the unemployment rate as high as it is for youth with disabilities, I'm hoping that someday we won't ask people, do they work? But we'll ask people, what do you do for a living?
Thank you, Jamie. We are now going to move on to the Q&A portion of the forum. We look forward to answering as many of your questions as possible during the remaining 20 minutes or so. Please be sure to state your name and affiliation when posing your question. For those in the room, please speak into the microphone so the webinar audience can hear you. And please limit your comments to one question only. For those attending online, please continue to submit your questions via the Q&A panel. Do we have a question from the webinar audience?
We do. We're going to start with a webinar question. Kevin Owen asks, there appears to be some disparity in the success of the study across the different sites. Have you evaluated those differences? Why did one site have greater success than another? Was the availability or level of TA a factor in this success?
Maybe I start, and then Kelly, you can weigh in too. So yes, we did notice and discuss the variation in the size of the impacts and the significance of the impacts across the sites. And I think several factors played a role. And TA, and Kelly could highlight that in her comments or observations. But the context is also sometimes different, particularly looking at the Montgomery County site where we didn't see significant impact on employment. There, the counterfactual was quite strong. And so that's one example. The other aspect is for some of the phase one sites, they were not completely focused on delivering employment-related services, or the intensity of the services were weaker in those sites compared to the phase 2 sites. The phase 2 sites actually effectively benefited from the experience of phase 1 sites. So those are the few factors I would highlight.
And I would just piggyback on what Arif is saying. The latter 3 sites, West Virginia, Montgomery County, and Miami, we did have a stronger emphasis on employment and providing technical assistance around those early employment experiences. And we did see, obviously, the impacts in Miami, which we talked about today, and West Virginia. And that technical assistance, as I talked about earlier, really focused on in the field. It wasn't just training and workshops. We were actually in the field with them, modeling behaviors with employers and how to do that outreach.
I'll just add that one of the things that the phase 2 sites, Montgomery County, West Virginia, and Miami did that the phase 1 sites did not do was regular monthly quantitative monitoring of employment outcomes and staff efforts regarding employment. That really kept them focused on providing paid work experiences to youth. Do we have an audience question from the in-house audience? Yes.
Jennifer Mizrahi from Respectability. Thanks for the extraordinary work. I want to ask a question. I'm very disappointed that there wasn't a better rate of return on investment on this much energy in terms of better outcomes in these different communities. It seems to me that this is not a very compelling case for further taxpayer investments compared to looking at some of the data from Project Search or Bridges to Work or other different programs. And I'm also particularly interested in Montgomery County because Montgomery County has probably the highest employment rate for people with disabilities in the country, with it being over 50% employment compared to the national average of under 30%. So I wondered what your thoughts were on whether you felt happy with these results or whether you thought, well, why is it that Miami, after all this treatment, isn't getting nearly as good a result as the people with no treatment in Montgomery County? What are they doing in Montgomery County that they should be doing in Miami and the other places?
These are very important and good questions. I mean, I'd say at the outset that these impact estimates show promise, even if they're not, swinging the ball out of the park. And of course, SSA will have the opportunity to follow these youth over time and see, even in the longer term, how those outcomes play out. In terms of the return to investment, it's obviously harder to do that judgment now because of the SSA waivers to the YTD participants. We were expecting increased benefits, and so we didn't see any reduction in benefits. But over time, after 4 years have passed, we will have to see how those benefits go down or not. And if that happens, then we'll be able to sort of make a stronger conclusion about the benefit costs of these interventions. And in terms of the Montgomery County sites versus the other sites, we did recognize that the Montgomery County site, even absent the intervention, had a stronger set of outcomes. And I think there are a few underlying factors that kind of explains the existing service system there is stronger relative to some of the other sites. For example, West Virginia, it's a pretty rural site in West Virginia where it was not easy for youth to access those kinds of services. Also, the participants themselves, the nature, the composition of the participants were different. In Montgomery County site, they were mostly in-school youth, and about 80% of them did not have SSA benefits. They were not receiving SSA benefits, whereas in the other sites, almost all of them were receiving SSA benefits. So that kind of speaks to perhaps the severity of their disability or their family income situation. So those factors probably played in a role. I don't know if Kelly and Tom, if you want to add more to that.
I would just add that some of the programs you referenced early in your remarks are much smaller programs than YTD. The YTD projects each served 400 or more youth where many projects targeted to youth with disabilities serve maybe a couple dozen youth a year. So in terms of being a solution, a potential solution to employment issues for youth with disabilities, it would be much easier to scale up a YTD type of intervention than some of these smaller programs. Question from the webinar audience?
Yes, we've had a couple questions come in about what type of employment, what type of jobs that the youth were doing either during or after the demonstration. And to kind of piggyback on those questions, Joanne Schneider asks, could you please talk about the relationship between the type of job and early work experience and their later work? The general literature says that relevant related work experience is key to careers beyond food, flitch, and flowers. Did your research find the same?
Well, I can speak to the work experiences and the jobs that they paid employment they were placed in during the intervention, and it did go beyond food, flour, and filth. We had youth doing a range of things, and I want to point out that we spent time, or the staff spent time doing that discovery so they could identify their interests and their strengths. And in the Miami site in particular, but with all the sites, we looked too at customizing jobs. So going in and negotiating with employers. In Miami in particular, tourism is a big industry. We had youth in five-star hotels working the front desk. We had youth in community-based organizations. We had somebody working on a golf course, working on golf carts, welding, mechanics. So it did go beyond that food, filth, and flour, if you will. So just really a range of jobs and focusing on that customized employment piece, competitive wages, integrated, and that's what it looked like in the Miami site. I can't speak to the jobs they're currently in.
Yeah, I would just add that from the survey data, what we observe is, most of the youth are not obviously placed in career jobs at this point, but at the same time, we have to keep in mind what are their counterparts, those without disabilities, what kind of jobs they're doing. So compared to those, these are probably comparable jobs. And to characterize it a bit more specifically, these are not really high-wage jobs either. And I think, if I remember correctly, the average wage was around $10 or so. Those are the sort of the nature of the jobs.
Yes, in the back.
Yeah, Maynard Freeze with Easter Seals. Maynard Freeze with Easter Seals. Again, thank you for the update on the project and some great numbers. My question is related to transportation. I was really pleased to see both in the issue brief and also in the PowerPoint references to transportation. As we all know, to have a job and to sustain a job, you need to get to the job. Can I ask about what role transportation education and travel training had in each of the projects? One, and also what, if any, actual research and findings were focused in on that issue. Thank you.
I'll start us off. In Miami in particular, I had mentioned that one of the community services that they did connect to was transportation. Transportation was an issue in all the sites. Miami, fortunately, has public transportation available. So case service funds were often used to supply transportation cards for them. There was also travel training provided. That often happened with the school partner. A lot of that was happening through the school. That being said, the customized employment specialist did spend some time training staff using public transportation and the people movers, as they call them in Miami. Montgomery County, same thing. using public transportation. At times, funds were used to help buy those transportation Metro cards, in Montgomery County's case, so folks could get around. I cannot speak as clearly to West Virginia, but I know that transportation obviously was an issue there, and they did address it, but I
Transportation, as you might imagine, in such a rural state as West Virginia, was a major issue. However, it was not a barrier to the program achieving pretty large impacts on employment during the first year after youth entered the evaluation. I think they increased employment by about 19 percentage points. And that impact persisted, although smaller, into the third year. From the webinar audience.
Amanda Green asks, what are the factors which contributed to the lack of statistically meaningful impact of this intervention in some places? And more specifically, why do you think youth self-determination did not improve in a statistically significant way in any site?
Yeah, I think I tried to address the first question earlier, so I'll just move on to the second one about self-determination. And I'm glad that someone asked that question, because it is possible. So we relied on the survey reports on items related to self-determination, and the items we had in the survey, because of we had to manage the length of the survey, they were not aligned with some of the already established indices of self-determination or a particular subcomponent of them. They were just sort of selected items from that. So these items were not pre-tested for reliability on a broader population. So we suspect that the weakness of the measure could maybe a factor in explaining the lack of impacts, lack of statistically significant impacts on self-determination.
Yes, in the back.
Hi, Jackie Cow from Mathematica. This is a question for Kelly about staffing in the Miami project. I realized that the employment specialists had support from job developers and benefits counselors, but there were 5 of them and 400 treatments, if I understood that correctly, which is a caseload size of about 80, which seems pretty high for an intervention like YTD. Yet there were statistically significant impacts in a number of key measures. So I'm wondering if you could comment on the role that caseload size plays in an intervention for transitioning youth with disabilities.
And you're right. They did have large caseload sizes in Miami. Typically in Miami, they were involved in services for about 18 months. The cases were assigned to the customized employment specialist, and they worked in partnership with the job developers. As I said, we spent a lot of time really defining roles and responsibilities. And the customized employment specialist worked primarily with the youth on those career preparation activities. The job developers primarily did that employer outreach. So they were going out and learning the needs of employers. On a weekly basis, they would staff, if you will, the caseloads. So they'd come together and talk about the caseloads. And they had what was called a hot list. And so when those youth had their employment goal identified, their strengths, their skills, and they were demonstrating that they had skills, and the job developer knew of a match, that person would move on to the job developer's caseload. And like I said, we called that the hot list, meaning they were hot, they were ready to place, we were ready to move them out into a work experience or paid employment. So there was that constant rotation of the caseload.
The other thing I would just add here is, so youth were enrolled and engaged in services over a period of time. So at a time they were not dealing with 80, each staff were not dealing with 80 cases, but the enrollment and service delivery happened over a 4-year period, so and in 2 phases actually, so that helped with the caseload.
A final question from the webinar audience.
Put me on the spot. We have a question from David Mann. Given the relative intensity of TA for the YTD sites, what does that imply for the scalability of the YTD model?
That's a good question, and I think there probably is not enough TA capacity at this time to scale up in a major way. It would take probably years to develop sufficient TA capacity to introduce a program like YTD more broadly. So we are now out of time. We hope you've enjoyed today's discussion. Please be sure to let us know how you think we did by completing the comment card in your packets or the electronic survey. And mark your calendars for the Disability Research Consortium's annual research meeting, August 5th and 6th at the National Press Club in Washington. And October 22nd for the next Disability Policy Forum, when we will discuss Stay at Work, Return to Work Policy Collaborative and its recommendations for helping people return to work following the onset of a disability.